been relying on external aid, at least for Uganda.
With donor funding expected to decline, Uganda faces real risks to health access and system stability. Richard Muganzi, the program's director at SEHAD, shared key findings from the study on Uganda's health financing amid its declining donor support. Some of the key insights from the findings include: heavy reliance on external funding persists, domestic resource mobilization is increasing but still low, sustainable, equitable health financing needs coherent policies and evidence-based strategies.
Health is not only about the health sector, it is also a multi-sectoral arrangement that requires each of the various sectors, like access to justice, you could also think of water and environment. You could also think of others like in the gender ministry. You could think of education, have to come and contribute something to the health budget, because health is a well-being issue that cuts across beyond health.
Julius Mukunda, the executive director of CSBAG, reflected on challenges and strategies for ensuring adequate funding for health services despite increases in revenue.
You would find out that we can actually borrow money and fail to use it simply because we are still planning, but we borrowed the money. And in the end, we are fined for not using the money that we committed to utilize. And the figures we have currently is that around 16 trillion is in undisbursed loans. And as of last year, we paid 73 billion in fines and commitment fees for the money we have not done. So that gives you a picture that surely it's not about lack of money, but how we have positioned ourselves to spend the money. And I think that's why even the issue of Roboa came in. And one of the things is that Roboa is a good case study. It was a hospital that was supposed to be built 3 years. 5 years down the road, or 6, we have not seen anything coming out of that hospital.
There is also belief that the government should look at pushing for a health insurance scheme so that every Ugandan can access quality medical care without worry of source of funding.
In Uganda, we have a bill in place which has not yet been accented to, but it has a number of concerns that have been raised by actors around how it will be coordinated, around who contributes to it.
It is the only way that can enable the lowest, our ordinary people, to access health care in this country. However, for 25 years, it is always shelved. So we need to ensure that the next government in power that comes really puts it at the top.
The shift away from abundant donor funding and need for innovation, efficiency and sustainability has driven the discussion on the importance of sustainable health financing in Uganda.
We really need to improve on the infrastructure, in terms of how many referral hospitals do we have. Right now we actually talk about the National Referral Hospital. And at the district level, at the regional level, there is nothing like a referral hospital. There could be hospitals, but are they at the level of the National Referral Hospital in Mulago? And who goes to the referral hospital in order to reduce the number of people going there? So, in terms of construction of facilities at the regional level was one of the things that we discussed.
Uganda's health financing system is a mixture of government, donor and private funding, but it faces challenges like underfunding and high out-of-pocket payments. For the 2025-26 financial year, the government increased its health sector budget significantly from 3.0 trillion shillings to 5.87 trillion shillings, but it's still below the World Health Organization recommendation for essential services. It is also below the Abuja Declaration on Health by African Union member states that, in 2001, agreed to allocate at least 15% of their annual national budgets to the health sector. Joram Paul Sonko, NTV Tonight.
Thank you so much, Paul. I think we still have work to do to reach the 15% of